Welcome to the Radically Genuine Podcast. I'm Dr. Roger McFillin. There is a fluid bathing your brain right now. It surrounds your brain, your brainstem, your spinal cord. It pulses with every heartbeat. It cleanses your brain of toxins while you sleep. And mainstream medicine has spent the better part of a century treating it as a passive afterthought. Present, noted, and largely ignored while building an entire model of brain health and mental illness around everything except the fluid at the center of the brain. What makes that remarkable is what is being ignored alongside it. Hindu yogic traditions map the flow of energy through the spinal canal thousands of years ago. Taoist medicine called the space at the center of the brain the crystal palace. Tibetan Buddhism developed precise practices around the movement of what they called inner nectar through the hollow core of the spine. Indigenous healing traditions across cultures have centered their understanding of life force on the same vertical channel running from the base of the spine to the crown of the head. Every major contemplative tradition on earth was pointing at the same anatomy, and Western medicine looked at all of it and called it mythology or mysticism. Meanwhile, a growing body of post-materialist science, peer-reviewed, rigorously conducted research that does not fit neatly into the materialist assumption that the brain generates consciousness the way a furnace generates heat, has been quietly building the case that these traditions were not describing metaphors, they were describing physiology. We have a mental health crisis our current model cannot explain and cannot fix. We have hundreds of millions of people on psychiatric drugs designed without any serious understanding of the brain's own internal signaling chemistry. We have ancient healing traditions that got the anatomy right millennia before we had MRI machines to confirm it. And we have an institution that has dismissed all of it while the evidence accumulated. My guest today holds an MD and a PhD from Harvard Medical School. He's a board certified in physical medicine and rehabilitation, serves as director of regenerative medicine and clinical research at Synovation Medical Group, and cares for veterans at the VA Greater Los Angeles Healthcare System. It's been featured a number of podcasts, New England Journal of Medicine, Psychology Today. He's trained in craniosacral therapy, polarity therapy, Reiki, and he does not think that is a contradiction with anything on the rest of that list. His name is Mauro Zappaterra, and the conversation we are about to have may change the way you understand your own mind, health, and experience. Dr. Zappaterra, welcome to the Radically Genuine Podcast.
Thank you very much for the invitation. It's an honor to be here, truly.
Well, can you take me back to the Harvard lab? You went in studying one thing, and something happened that clearly changed the direction of your entire life.
Clearly changed. It's a great way of putting it. Some people would say I met my then wife. To be honest with you, I was studying cancer cells, and I was always fascinated in how things developed or how things became physical forms, and cancer cells were sort of things that had gone wrong. And she sort of looked at me and said, doesn't sound like it doesn't seem like you're truly fulfilling your passion. I can see you, but how about we take some time off and go find some things that might spark your interest a little bit more. And I was on the borderline of depression myself, struggling with sort of the day in and day out of going into lab and not really finding a true purpose in the work that I was doing. And she saw it immediately. And so we actually decided, much to my not wanting, because I didn't think it was actually possible to do it, but she said, why don't we take some time off and travel? And I was actually able to take 8 months off from medical school. I was right in the middle of medical school. I was in the at Harvard. What you do is you do 2 years of medical school, and then you do a rotation in internal medicine, and then you leave the medicine part and you go off and you finish your PhD. It can take 3, 4, 5, 6, 7, 8, 9 years, however long that takes. And then you come back and you finish your medical school. And so I was right at the end of finishing my 2 years of medical school. and she wanted to study holistic healing. And I was always interested in holistic healing. I was always interested in acupuncture, acupressure, meridians, energy channels. There was always this sense of something beyond the body. Even in college, we'd see how close we could actually get to each other and start to notice some sort of felt sense of bodily sensations without touching. And so there was always a sense of like, wow, that's really cool. And I'm going to go learn medicine and I'm going to be able to integrate these things. But when I got to medical school, it was great from the anatomy and physiology perspective, but it was lacking that other sense. And so when she said this, I was like, that's cool. You can go learn that. Like I'm going to take some time off and then sort of enjoy my time off, because I don't really want to do anything. Right. And she's like, no, you're doing this with me. And that was really the start of this investigation. She found a school called the New Mexico Academy of Healing Arts, and this was back in 2004, mind you. So quite a number of years ago, and we went and studied what's called polarity therapy, and this is it's a sort of it's a whole body holistic healthcare system that integrates Ayurvedic medicine, it integrates Chinese medicine, it integrates Egyptian medicine, it integrates Western medicine, it integrates naturopathy, it integrates chiropractics, osteopath. He was a combination of an osteopath, chiropractic, naturopath, Dr. Stone. And, his thing was always, I go and I manipulate the body. I might do a chiropractic adjustment, and then 2 weeks, they come back with the same patterns. And so the essential philosophy is body work, so touch, healing touch, movement, so how we move and exercise and get the, flowing of fluids and strengthening the body parts, nutrition and detoxification, and then positive thinking. So there was a sort of a fourfold factor there in terms of how to treat the body. And it was very much in line with the way that I was, let's say, treating myself, or the way that I was hoping to treat others. And so it worked quite well. And one of the teachers there was a craniosacral therapist, and we were able to learn and do these sessions on each other during anatomy class, where we would just hold the skull. So imagine where, you're on a massage table, and the only thing we were told was, have your client, or there were other students. And so, it was each student working on each other. So we were learning, and it was just sort of, have your client or student lay on the table and just hold the skull and see what you notice. And, I'm like, you gotta understand me. I'm sort of a skeptic, right? So I was known as like skeptic in the class. Like, people were talking about auras, and, and even though I felt it and sensed it, I was still a physician scientist at heart, right? Show me the evidence, show me the proof, show me this, show me that. So I was a big skeptic, right? And so when they said, you're just going to hold somebody's skull and you're going to notice what happens, I'm like, oh my God, this is going to be a waste of time, but it was sort of like, oh, well, we didn't have to look at anatomy because I already done 2 years of medical school. So it's sort of like, we didn't have to look at anatomy. So maybe it's a time for me to rest and take 20 minutes and close my eyes and sort of refresh myself. And what started happening is, it was essentially, like you said, the beginning of my new life, in essence. Not only was I, as the practitioner, was I feeling things that, I couldn't make up. As the client receiving the sessions, it was sort of like there was sort of like an instantaneous tap into some sort of energy field. I didn't know what it was at the time, but I was coming from a perspective of, I had done 5 years of pretty intense research before that. I'd gone to 2 years of medical school. I was designing experiments in the laboratory. We were publishing papers in very high end peer-reviewed journals. We were setting up experiments in terms of how to design a hypothesis, how to test the hypothesis, et cetera, et cetera. And so there's a natural inclination of, when you feel something, right, in your body, if you felt your heart beat and you felt a slight palpitation in your heart or a slight arrhythmia or some sort of change in the beating of your heart, you would question it, right? You'd ask, what is that? Is it, how long is it going on for? Can I breathe? Am I getting oxygen in my head, right? Like, and if you're not, you're going to pass out and probably somebody's going to call 911 and you're going to go in and they're going to say, well, you have an arrhythmia, right? But you're going to notice it and you're going to question it. And so it was the same thing. It was sort of like I was noticing this energy, right? It was a palpable, felt sense in the body, and it was outside of the body, and it was like sort of transformative, let's say. And it was rising for me. The initial experience was it was rising from my sacrum, from like sort of my pelvis area, through my body and also outside of my body, but mostly localized in my body. And it was rising through the spinal cord up into the middle of my head, right? The middle of, essentially, I would call it the middle of my head. And I was just really curious about it. And it had this sort of rhythmic pulsation to it. And that was interesting as well. And at first, what I did is I said, well, is this my heartbeat, right? Am I noticing my heartbeat? So I put my fingers on the carotid artery and my radial artery. And I'm like, no, this is different than the heartbeat. I was putting my hands on my chest. This is different than my breathing, for instance. What else could it, my heart rate, breathing, what other rhythmic pulsations do you know in your body? And it was different than all of them. And so I just started paying attention to it. And when I started paying attention to it, it had this rhythmic pulsation. It was rising up my spine and it coalesced. It felt like there was like a gathering. It was almost like if you're like a shepherd and you're gathering like the sheep in a field. It was sort of like there was like a coalescing of energy that was happening right in the middle of my brain. And when I assessed, like, where is this in the middle of the brain, right? Like, and having a background in anatomy, having gone through medical school, I could close my eyes and sort of visualize different anatomic body parts. And it was absolutely clear that this was coalescing in the third ventricle. And for people that don't know, the third ventricle is it's a fluid-filled space. It's a space essentially in the middle of your brain. It's right in the midline. So you have one third ventricle. So if you were to draw a line essentially from your brow center directly into the middle of your brain at about the height of the top of your ears, there's a fluid-filled cavity, and that's the cavity that you referred to as the cave of Brahma or the crystal palace. And this is a cavity that is filled with fluid. And it was sort of like, as soon as I said, oh, wow, it feels like it's the third ventricle that this fluid is coalescing to, there was almost like a response, like the fluid or some sort of energy was responding to the recognition that I was locating it to the third ventricle. And that might sound totally strange to people, but there's a big part of a lot of this work and the work that I've continued to do of not only understanding the basic anatomy and physiology of the body as we know it today, but also being open and curious about what you're noticing yourself as a sensation. And also, when you are curious about that, see what happens in terms of, prior to this, I'd be like, well, it's just a fluid. There's no, like, it's not like I'm going to go out and have a relationship with this fluid or anything like that. But as soon as I recognized it, I'm going to say awoke it. It woke up. It was like there was this dormancy, but it wasn't asleep. It was alive, but sort of quiet. And as soon as there was this sort of recognition, it woke. It was like, hello. And that was honestly like, it was almost as if I could have like a conversation with it, like a relationship with it. And, trust me, I'm not like schizophrenic or anything like that. I have conversations with my body all the time. I have conversations with the energy in the body all the time. I have a relationship with it, right? And that has developed since that moment. But then, right, as being a scientist, you say, well, that, the first time that happened, that's cool. Second time that happens, does it repeat itself, right? Is this repetitive? Is it present in more than just one sort of one-off? Was it because I had some strange, thing for breakfast in the morning, or I didn't get enough coffee, or I had too much coffee? All those things, all those factors, those are all questions that went on in my head, right? And yet it was reproducible, and it happened all the time. And I could, as I became more and more acquainted with it, it was easier to be aware of its present, let's say. And so therefore, I didn't need to go through so much preparation to say, oh, there it is, if that makes any sense. And that was the start of questioning, what is this? And the conversations that have led from there, which is, like you mentioned, there's this fluid in the third ventricle. And so I started asking, I just went on to PubMed, what do we know about the cerebrospinal fluid? And, this was 2004, 2005, and there was very little known about this fluid. And I said, wow, this is incredible. I have to sort of sit down and do my PhD, right? If we don't know much about this fluid, let me learn a little bit about this fluid and possibly propose a PhD that I could do, go back to Harvard, find a scientist, if I could, find a mentor that could mentor me in this, find a lab that I could do this research in. And that essentially took off, this entire career of not only the cerebrospinal fluid, but its implications in health and disease, as well as consciousness and regulating the nervous system and, chronic pain and mental health, et cetera, et cetera.
So curious, as you started to experience this awakening, so we've heard people talk about, this third eye opening, or this experience when you draw energy there. Were there any other gifts or spiritual, metaphysical shifts or changes that you experienced alongside of that?
No.
Okay.
No, there was nothing like, nothing that we would consider to be what, the language or the, people call supernatural or anything like that. I would consider it to be supernatural in that there was the initiation of the relationship with my true self, with myself beyond the body, with an energy that is ever present and everlasting. And if I was to describe that, it would be considered love. That, to me, is beyond any supernatural talent that people think about when you're thinking about sort of some of these, I don't levitate. I don't disappear. I can't walk through walls yet. But I also haven't tried, right? And there wasn't anything, but this sort of relationship with the self emerged. And that is, I'd say, more supernatural than any sort of special ability.
Yeah. So you're talking about connecting with an energy field that existed when you were holding the skull of a patient, right? And now there's this emergence and this connection to what you called a true self. So then my next question, or at least where my mind goes, or do you develop the intuitive abilities to be able to tap into that person's energy field and then help you as a practitioner in being able to understand what might be going on with your patient?
All of the above.
Okay.
And yourself. Right. And so there's right? There's not only the intuitive, there's the development of those intuitive capacities, but then there's also the development of your own self, the introspection that occurs from just recognizing the energy within, and then the energy that is dispersed beyond my body, and the energy that is with you and all individuals, but not only all individuals, all plants, water, all material objects, everything. And that, and beyond even this world. And so that to me is like, a greater gift than any other gift that somebody could give you, for instance. And the thing about intuiting somebody else's energy, right there, I'm careful with that as well, because a lot of the things I do is, actually run, you kind of learn how to run the energy through your own body. And I sort of see it as this energy channel, or these energy vessels that are present. And we have the capacity, like a faucet on a hose, to run these energy channels. And, the closest thing that I would equate it to would be like Alex Gray's images, for instance, with all these sort of channels or lines that are going through, but yet all connected to this matrix on the outside, right? And yet it's not separate from the self. And so, and it happens. Let's say I'm seeing a patient, and they're not happy with my treatment plan for whatever it might be. Maybe there's cocaine in the urine or something like that, and we can't continue prescribing the medications we're prescribing, or we got to shift, right? And they're not happy, and they yell at me, right? What I do consciously is I actually open up those energy channels in myself. It's almost like I have the faucet. Turn up the faucet, turn on the faucet, right? Let the energy flow. And then that flow, it's sort of like the words, language, anything. But the same is, if you're palpating something and you feel something, it's like, I'm not there to fix it. I'm there to simply observe it, witness it, and allow the energy to flow. Like, allow the innate and energy, allow like the blueprint to come through, right? And if we can do that, whether we do that for each other as a therapist or as a counselor or as a healer or, as a massage, whatever it might be, or if we can do that for ourselves, then that to me is sort of like, that's the essence, right? Is I'm connecting in and allowing the blueprint to reestablish itself, and allowing the energy to flow, as opposed to, I noticed this sort of tension there. Let me go in there and let me try to like just get rid of that tension. Well, if we don't look at the entire system, right, that might not do anything. It might do something for 1 or 2 days. And I think that's what Dr. Stone was getting at, is I was adjusting these necks and these backs, but then they were coming back because there was something in the field, or something that they were eating, or something that, the way they were walking, or whatever it is, that was causing their energy system to have them go back to that same pattern. And so that's to me is sort of like, can we get so open and curious, and can we increase the sensitivity of our own introspective ability to not only notice that for ourselves and be able to do that for ourselves, but also help others do that too. And so that's kind of where I go with that.
So you returned to Harvard, and I think everyone who's listening would assume that these are two completely different worlds, from the place that you were in New Mexico and what you were learning back into the mainstream, the pinnacle in at least Western society of medical training. How did you come to integrate this? And can you tell us what you ended up studying for your, for your PhD? How did you find an advisor that was aligned, and where did it go from there?
Yeah, beautiful question. So for me, it wasn't a problem at all because, when I go to sleep at night, these are sort of the things that I'm listening, that I'm paying attention to, that I'm thinking about is, what is this energy, right? Like, that's the question. What is this energy, right? Where could this energy, right? Where could this energy be emanating from or coming from, right? And so let's just take an example. We could take the example of the heart or the brain, or we could take an example of a nerve coming from the spinal cord, or we could take an example of a blood vessel, right? If I palpate your radial artery on your wrist, I'm going to feel a pulsation, boom, 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 right? If I have an instrument that's sensitive enough, how far away from that radial artery could I actually get a sense of energy that's coming off of that? Right. And again, it comes down to the instruments that we have that are able to see or test objectively some of these quote unquote energies. Come back 2,000 years from now, it's going to be incredible what we're going to be able to see. And that's part of the research that we're proposing and doing, is designing more sensitive technology that can actually assess these energetic fields, right? And so if you took the heart, for instance, right, the heart is not only is a muscle that is constricting and pumping blood, that nobody would argue with you that it doesn't have some sort of energy that's right. We measure blood pressure. It's got 120 over 60 millimeters of mercury, right? That's a pressure that I'm feeling. If I put my hand over the aortic artery, right, when you're doing, I was lucky enough to do one of my rotations in open heart surgery and see the aorta, right? See the aorta pulsate when the heart is pumping. The amount of electromagnetic energy that we can actually measure from the heart itself, because it's got all these, it literally, not nerves, but electrical, wires around it that are emitting electrical energy from it. And so if you think of things like chakras, right? People, I go back to Harvard and I'm like, and my wife and I, we actually did it. We taught polarity therapy. We had what they called it, a complementary and alternative medicine day. And we taught polarity therapy and we did it together. And my thing was, how can we what I would call spiritual anatomy, let's say, right? A chakra, the word solar plexus. You might know the solar plexus from a chakra. Maybe when you get nervous, you have a tightening in your solar plexus, right? But if I was to open up your body, I could actually find your solar plexus anatomically. I could find a bundle, right? What is a plexus? A plexus is a bundle of nerve bodies. It's a bundle of nerves where the DNA of the nerve is, and then the axon or the dendrite gets sent off from the nerve body itself. Could you imagine, right? Could you just imagine I could actually go in surgically and grab your solar plexus, grab the body, grab the cell bodies that made up your solar plexus, and I could move it around, right? And this is the way that I talked about it, essentially. Could you imagine that this bundle of cell bodies, that this bundle of nerve bodies, actually people could feel inside of them? Like, could there be some people that have an ability to sense the energy that's associated with their solar plexus physically? And it's undoubtedly, the answer to that question is yes. And when I would present it to even, neurosurgeons, neurologists, cardiologists, even they would be like, I don't see why not. And so if you don't see why not, right, I just showed you that this was a physical bundle of cell bodies that people actually looked at and said, there's something energetically going on in this location, right? And there's something energetically going on in the cardiac plexus, right? And we could go to all the different plexuses. It's amazing to take that, right? To take either the chakras or the meridians or whatever it might be, right? And sort of overlay it on real anatomy, on anatomy that is present. And so that's sort of the way that I looked at it was, could you take something that I'm showing you that somebody's saying that they feel something in their solar plexus, and I could show you that this is actually cell bodies that are clumped together, right? Are there people that you think could actually feel that, could actually notice that when they have changes in those cell bodies that they can actually perceive that sense? And it was undoubtedly yes. And so that's where we started, right? Is the overlay. There's so much more overlay and union than there is separation that it's absolutely crazy. And so my job, I saw it, was, can we find the language and the way to communicate with each other that was unifying and not divisive? Could we find a way to communicate in ways that was harmonious and not, oh, you're doing this over there, you're doing this over there, right? And honestly, what I noticed is if you were really open and you really want somebody's health in their best interest, you were open to it. People were open to it, right? And so it was really about learning. It was really about finding the language. And majority of people, unfortunately, who go to medical school don't learn the language that the craniosacral therapists are using. And the people that are studying to a craniosacral therapist don't learn the language that the surgeons are using. So I felt like I was in this really, I don't know, what you want to call it, blessed, sacred spot where I could actually communicate with both sides and help people come together, as opposed to separate. And so that's what we were doing. All my friends, when you're in the MD PhD, all my friends loved what we were doing. They were like, this is, that's really cool. My wife was giving sessions. I mean, we had neurologists and anesthesiologists who found out what we were doing. I was still going to lab, and so I didn't have the time, but they were being referred to my wife for care. Like they're like, I'm feeling this or that. And they were going to my wife. There was this understanding. And so it really comes down to the language that we use that tries to bring us together. And then the other thing is, look, I want the best for you, right? I want to, if I really truly want to help you and decrease your suffering, why would we ever limit what the possibility is of the care that we would actually consider for you? Why would I ever say, no, that doesn't work? Why? Why? Am I causing harm? Am I, is the care that I'm providing cutting off your limb? No, it's not. It's not causing, it's not causing harm. I have to look at the dangers, right? But if somebody proposes something and says, hey, look, I got this crystal and I'm going to hold it in my pocket, there's something, hey, go for it, right? If that works for you, go for it. I don't know. We don't have the studies to actually show whether or not that specific crystal does. Maybe now, as we're gathering studies, but it costs a lot of money to do studies that are quote unquote evidence-based, right? And even that term, you start to sort of, oh my goodness, what is evidence? Well, if you haven't done the study, then there's no evidence. But lack of evidence is not that there's no evidence. It's just nobody's done the study. So you can't you can't say, well, there's no evidence. Well, nobody's ever done the study. So of course there's no evidence. Who's going to fund a study on a rock? We don't have, the Rock Society that has billions of dollars to do these sorts of studies. And so, being open to that and saying, hey, look, if it doesn't cause harm, right? Can we look at what they're actually offering you? And, if that doesn't cause harm, then go for it. And so the people who are more open towards wanting the best for you, were, great. So I went back and I knew that I completely switched, right? So I sort of like I was studying cancer, and then said, I gotta study brain development. I got something in brain development in regards to the cerebrospinal fluid. And Christopher Walsh, he was the head of the MD PhD program. I was in communication with him quite a lot in terms of, because I was taking time off and I just had to organize. And, I started just communicating with him more frequently and started asking him like, hey, I'm really becoming interested in the nervous system. I'm really becoming interested in this. And he essentially said, why don't you take a look at my lab? And I thought, wow, what an interesting, what an open character, right? Here's a guy who knows that I was struggling a bit, knows that I wasn't so happy in my other lab, knows that I was taking some time off, and then offers me an opportunity in his lab. Right? It says, hey, why don't you come check it out? You might like some of the experience, some of the experiments we're doing. And one of the benefits of him that I didn't recognize a priori was that he was what's called an NIH. He was a Howard Hughes investigator. When you're a Howard Hughes investigator, so when you get a grant from the NIH, you have a grant, let's say it's a 3 or 5 year grant, you propose the experiments for that grant, and then you do those experiments and you get funded essentially based on how those experiments are going. When you're a Howard Hughes investigator, what happens is that Howard Hughes thinks that sort of, in general terms, you're such a great and amazing scientist that we're just going to give you funding and you can do whatever you want with that funding. And so he was a Howard Hughes investigator. And what we were able to do with the studies on the cerebrospinal fluid was, essentially because he was a Howard Hughes investigator. And then it became, and then people now at Harvard have labs that are studying the cerebrospinal fluid. But essentially one day I was studying, and I was looking at these cross sections again of there were anatomic cross sections. And I show these on some of my talks. It's a cross section of an 8-week human embryo, and the cortex, what's going to become our brain, is maybe about 2 or 3 millimeters thick. And in the middle, there's this space. And then in the middle of that, there's this like cauliflower-like shape that's coming up, right? And I have no idea. I'm like, what in the world is this cauliflower shape? And so I turned to my colleague who was a postdoc in neurology at MGH, and I go, hey, what's this here in the middle? He goes, well, that's the choroid plexus. And I go, the choroid plexus? I'm like, Jesus, that's huge. And, the choroid plexus is the anatomic part that makes the cerebrospinal fluid. The choroid plexus looked about 100 times bigger than the cortex itself. It was this huge cauliflower shape. And the choroid plexus, essentially what it does is it releases cerebrospinal fluid into that cavity of the brain we call the ventricle. And then you get this tiny little cortex above, right? As the cortex then develops and becomes our brain, the ventricles become smaller, but the choroid plexus is still, it's sort of like this curtain of vascular tissue that hangs in the ventricle itself, and it continues to produce cerebrospinal fluid. But it was instantaneously clear. Here I was getting these sessions of craniosacral and having these experiences, and in the embryo, the cortex, what becomes the brain, is 2 or 3 millimeters thick, but the choroid plexus, what makes the cerebrospinal fluid, is huge. It was like, wait, not only is the cerebrospinal fluid doing something in me right now and I'm connecting with it, but developmentally, there is a huge role of the cerebrospinal fluid in development. And what are we always fixed to, right? When we walk into a room, you look at the walls, you look at the things on the walls, right? You look at the paintings and stuff like that, but do you ever pay attention to the space? You walk into the room, it's actually, the space is the room. It's actually more defined by the space. You're in the space, but we forget about the space, right? And this is actually very analogous to sort of awareness and consciousness and thoughts and things like that. We pay attention more to the thoughts than we do to awareness, right? And so what we do is we go to the brain, right? Well, the brain is a tissue. You see the tissue, but you don't see the space. So what we started doing is we started saying, wow, that space is the space that the fluid is held in. But we don't see this. We don't see the fluid when we dissect things because the fluid, it leaves instantaneously. And yet, when I grow cells in a petri dish, I need those cells to grow in fluid. I can't take, months and weeks of vacation when I'm in the lab because I got to go and I got to replenish the fluid and add growth factors and add electrolytes and add sugar and add, all this stuff. And we got to wash it out and take off the toxins and add more media. We call it media, right? Tissue culture media. Okay. And it was just like, here I am, right? Getting this, and instantaneously from that slide was, oh my God, this fluid is super important in brain development. This is the endogenous tissue culture media for our brain during development, right? And so instantaneous. So I remember sending in an email being like, I'd like to do my PhD on this. Here's this image. We're always focusing on the cells and the tissue, but can we actually do a study on the fluid? And it was like, boom, instantaneous. Like he jumped out of his office. I actually went and got a cup of coffee, so I wasn't there. And he was pissed that I wasn't there because he was so excited and he had to like retroactively share his excitement with me because he was so excited. And, when you're a grad student and you have an idea like that, that's based on not only your own experience and sort of, thoughts of this fluid, but also being able to tie it into something that can actually be studied and experiments could be done on it is pretty cool. And so I spent the rest, I spent 5 years essentially studying the cerebrospinal fluid in brain development and what it does, in Chris Walsh's lab, NIH, Howard Hughes funded. And now there's professors at Harvard who this is doing the lab work has become their career.
So what is it actually doing?
Oh, great question. So first of all, right. So there's a couple things that it's doing, and then there's a couple things that it's connected to. So first of all, it's when we develop, right, all of the stem cells, the neuronal stem cells at a very young age are bathed in this fluid. So when we are, 40 days old in the womb, right? You're like a hollow tube. You're essentially like a hollow tube. In the inside of that tube is the cerebrospinal fluid. Okay. Every cell that's contacting that cerebrospinal fluid is a neuronal stem cell. So that's going to go and make up your entire brain and your entire spinal cord. All right. So first of all, the fluid provides hydrostatic pressure. So just having fluid in the canal provides hydrostatic pressure so that when your brain develops and when your spinal cord develops, there's sort of, it keeps it up and open. If you just pierce it, the brain collapses and you actually alter development. So you're not only getting rid of the fluid, but just this fact of having a hydrostatic, this sort of pressure in this cavity helps with the brain continuously developing. The fluid, right? It's not a static fluid. It's a very dynamic fluid. So you could imagine, right? Every single stem cell is bathed by the fluid. If you wanted to change what the brain was doing, even developmentally, the body, the embryo, could deposit like a growth factor into the fluid itself, and now it gets distributed to all the neuronal stem cells that are bathed on this fluid. If it makes sense, it's sort of like the cells are the shore and the fluid is like the ocean. If I wanted to bathe the shore, I could put something in the ocean and the ocean takes care of it for me, right? And so what we found was that there's a ton of growth factors in the fluid, and they are all dynamically changing their concentrations based on what the brain is going through. Does the brain do we need to make more cells, right? If you think of like, here I am, I'm a tiny embryo. Well, what's the first thing I need to do? If I take all those cells that are stem cells and develop them, now I don't have enough stem cells. So I can't make a big enough brain. I have to first make enough cells, or, have those stem cells proliferate, like have a stem cell become another stem cell, become another stem cell, become another stem cell, become another stem cell, right? And get enough stem cells and then differentiate and become neurons so that my head can be as big as it is and your head can be as big as it is and our brain can be developed, right? So at some point in time, it actually is sending in factors into the fluid that are guiding this proliferation. So you get more proliferation, right? At a very, very young age in the embryo. And then it actually changes and it instructs those stem cells now to differentiate, to actually separate from being bathed by the fluid and go out and start making the brain, right? So it's got factors in there for not only proliferation, but also differentiation of neuronal stem cells. It provides the perfect fluid niche for neuronal stem cells. So we were actually able to take purified neuronal stem cells and grow them purely with cerebrospinal fluid without adding any other external culture media. And they maintained what we call stem cellness. They maintained their pluripotency. Okay, usually if you take a stem cell and you change the media, that if you take it out of its environment and you change its media, it differentiates quickly, spontaneously. It sort of becomes whatever, if it's a cardiac cell, it becomes if it's a cardiac stem cell, it becomes a myocyte, and et cetera, et cetera. We were actually able to maintain it as a stem cell, right? Indefinitely. And so it provides the perfect fluid niche for maintaining stem cells. It provides developmental cues for the developing brain. And then as we get more and more into sort of development, it provides nutrients, growth factors, electrolytes. It provides now, in us, it provides buoyancy to the brain. It has, it helps control appetite and sleep and diurnal cycles, et cetera, et cetera. So it's got a whole bunch of different functions. And just recently, research has shown that at first, right, I've been talking about the fluid being in these ventricles. Well, just recently, this was just in 2013, so about 13 years ago was the first study that showed this, was showing that sleep can change where this fluid is located and allows the fluid to go from the ventricles into the brain tissue itself. So fascinating, right? We always thought that, I kept on saying, right, it's located primarily in the ventricles, these hollow cavities in the brain that are filled with fluid. But now there was research that showed during points of sleep, the fluid actually went into the brain tissue itself. Well, why would it do that? Well, it's quite interesting that there's this rhythmic sort of flow. There's this rhythmic pulsation of when we sleep, neuronal activity slightly decreases. When that happens, blood flow slightly decreases. And when that happens, you get this pulsation of cerebrospinal fluid into the brain tissue itself. So you're sleeping, neuronal activity decreases, brain flow decreases, pulse of CSF into the brain tissue. Brain activity decreases, blood flow decreases, pulse of cerebrospinal fluid. Okay. What they found is that this cerebrospinal fluid goes into the brain tissue to clean out the toxins that build up in the brain tissue throughout the day. And that's quite intelligent, right? So you're sleeping, and then it's sort of like the dam opens up and the flow of fluid goes into the brain tissue, goes into the space between the cells and cleans out the tissue for all the toxins, regular toxins that we build up throughout the day just by using our brain, right? So that was one of the first studies that has ever shown the importance of sleep, right? But then you've got to think, well, it can't only be sleep. And that's, and that's always been it's sort of like, well, it can't only be sleep that allows the cerebrospinal fluid to flow in between in between the brain tissue, because there's a lot of people who, let's say, don't need sleep but are still functioning quite well. They don't need as much sleep, right? And so now, right, we're looking at states of parasympathetic activity. So different states of parasympathetic activity can actually increase this cerebrospinal fluid flow through the brain tissue itself. We're looking at breathing.
Can I ask you a question first about sleep? Because in my field, in clinical psychology, we have people with PTSD, chronic pain, people on so many different psychiatric medications that seem to also disrupt normal sleep patterns. So what happens to the brain's waste clearance system when sleep is chronically disrupted in this way?
So the hypothesis is that the brain clearance system also is disrupted. So you're not clearing the toxins that build up. And what's interesting is, as we learned those studies and we learned those results, you mentioned sleep medications, right? There was one study that actually looked at Ambien. And Ambien, even though you felt like you were sleeping, it did not clear the brain waste like sleep did. And so even though you're sleeping, the physiologic mechanism that's occurring at the fluid level is disrupted, right? And so that's why, if you can, of course, right, if we need sleep and you use those medications, but trying to use techniques that decrease the use of medications as much as possible, especially for sleep, or having other things in your life that you are doing that can activate this brain cleansing mechanism that helps us cleanse the brain. And one of the studies that everybody's looking at, because they've actually seen these studies, and you've talked about, correlating this with yogic practices, is breathing, right? Breathing practices, different types of breathing practices have been present for millennia. And these are ways of actually not only altering our consciousness. We have used breathing practices for millennia to alter our consciousness, but also for regulating our nervous system, right? And so when you're talking about a society that is chronically stressed, that is having difficulty sleeping, if we're not doing something that is looking at helping balance our nervous system, or bringing some increased resiliency to our nervous system, so that when we need to trigger the stress response, when we need to trigger the fight or flight response, we can trigger it. But we can also trigger the parasympathetic, the rest and digest response when we need to trigger that. And most of us don't have the capacity. We're overstimulated. We're oversympathetically driven. We can't relax. We're having problem digesting our food. We are constipated, or we're having diarrhea, et cetera, because that's an overstimulation. It's an oversympathetic drive. We are in a constant fight or flight response. And so doing practices like breathing practices or meditation practices that help increase that flow of cerebrospinal fluid through the brain, and that also help balance the nervous system, can, let's say, can they overcome? We don't exactly know because there aren't the studies done. But I don't have the time to wait for these studies, right? And so therefore, would I recommend that if you need a medication to sleep and you need that to feel rested, great. You might be altering your brain clearance mechanism system through altering the flow of this fluid. Let's find something else that you can do during the day consciously, right, that can get this fluid activated and that can help balance your nervous system so that maybe you can sleep better and you can come off those medications.
Okay, so help us now understand. There's various terms that I want the audience to understand. One is to know what the pineal gland is. and what Kundalini is, or that Kundalini energy. Can you explain that kind of connection and what this means for the everyday person?
Yeah. I mean, there's a lot written about both these glands. The pineal gland is a really cool gland. It's in the middle of your. It's anatomically, it actually sits in the back of your third ventricle. So, if you were to, and I highly recommend people kind of go online and like look at images of the third ventricle, and then look at images of the pineal gland and where it is in relationship to the third ventricle. And it's it sits in the back of the third ventricle. It's described essentially as a pine cone shape. The majority of function, we're still trying to understand what the pineal gland does, but the majority of its function is it's a gland, and it releases melatonin. Melatonin people think of as as a sleep hormone, and it can help us. It can induce sleep, but it has very powerful properties of like antioxidant properties. It can help reduce oxidation and inflammation in the brain. And so for people with like brain injury or stroke, right, you can supplement with melatonin as an antioxidant hormone. There's lots of studies done on melatonin in terms of how it actually functions, and melatonin is released from the pineal gland and is released into the third ventricle, into the cerebrospinal fluid, and it is also released in the blood. But the concentrations in the cerebrospinal fluid are like 100-fold more than what's in the blood. And so it's believed, right? So this theory of releasing something into the cerebrospinal fluid and allowing the cerebrospinal fluid itself to sort of distribute it throughout your brain is consistent with the way that melatonin is thought to work from endogenous melatonin. In that when we perceive less light exteriorly, our eyes are getting less light. There's a connection between our eyes, our actual eyes, and the pineal gland. And the pineal gland, as the light starts to dim down, the pineal gland starts to release melatonin. All right. And as the lights get lower and lower, it releases a certain amount of melatonin from the pineal gland. And usually what happens is that most people should fall asleep during that time period. What we have done, though, is we have artificially messed with this internal clock. We have used external lights and different types of lights, and we stay up and watch bright television, and it activates our light. It activates our eyes. And we're looking at the screen, and we're looking at the screen way into the late hours of the night. And this increase in melatonin is never allowed to, it never comes up because we're constantly stimulating. And then we turn everything off and we're expecting to be able to go to sleep. And yet that hour or so or two of slowly increasing and having it diffuse through the cerebrospinal fluid and affecting us hasn't happened. And so then you're sitting there and you're going to be up for 2 hours, right? Or more. And then you're going to be frustrated, and then your thoughts are going to go, and then that's going to probably generate more anxiety, which is going to lead you to sleep. And then that's another vicious cycle, right? So, the pineal gland, interestingly, right? So melatonin, that's the number one function that people are pretty aware of. The other one is actually, it's believed to release dimethyltryptamine, DMT. All right. So DMT is found, it's a hallucinogenic. It's an entheogenic molecule, right? It's found in ayahuasca. It's found in the sacred toad. People use purified DMT to have very hallucinogenic, entheogenic experiences. It's used for ritualistic practices in various religions. And it's one of the strongest hallucinogens that we know. And now people are doing studies on it in terms of studies for PTSD or studies for anxiety and things like that. And I would, I would encourage people to sort of pay attention to these studies because they're being done very rigorously. But the pineal gland releases DMT, dimethyltryptamine. So we have, right, an endogenous DMT in our bodies. Cerebrospinal fluid has actually been found to carry one of the highest concentrations of DMT in our body, right? What is its function? We're still trying to understand its function. Okay. But studies are starting to correlate it. It's very difficult to isolate it. So again, machines and systems need to be created that have the sensitivity of, analyzing things like DMT. There was a study done that essentially looked at DMT. It was done in rodents, but that, when they had a cardiac arrest, that the DMT in the visual cortex of the rodent increased. Right? Why would you have an increase of a DMT in the visual cortex in the area of the visual cortex in rodents that were undergoing cardiac arrest, right? And so then the hypotheses are generated from that because of, let's say, stories from people who have had near-death experiences or visualizations that people have had in altered states, right? Is you close your eyes, but you still see something. You see shapes and you see colors, and they're often very vivid. Or in people who have near-death experiences, they see, like a white tunnel, and they're replaying their entire life, and they're seeing they're going towards this white tunnel, and there's a choice that they get to make, and all this stuff. These are real stories, right? And so the fact that DMT was increased at the time of cardiac arrest in the visual cortex, was that generating some sort of activity in the visual cortex that allowed the visual cortex to be more active during that time period, right? But if we know we have endogenous DMT, right, and it's coming from the pineal gland, and it's possibly coming from the adrenals, and it's been found in the lungs, right? What are we learning in terms of, can we modulate it ourselves, right? Can we actually do practices that can learn how to modulate DMT from the pineal gland into our cerebrospinal fluid, or from our lungs into our blood supply? And these are ongoing studies that are going on right now. And so hopefully we'll have the results of those studies. But if it's such a powerful hallucinogenic and theogenic molecule, right, that we might actually have the capacity of modulating it ourselves, can we modulate it to help decrease our own suffering, or help us have those visions of those entheogenic visions and bring us closer to God or our true self or some divinity or some sort of whatever we want to call it, right? And that I think is very powerful. So from my perspective, I like to look at the pineal gland as its relationship with the cerebrospinal fluid, right? With its relationship with this fluid, and not forgetting the thalamus, the hypothalamus, and the pituitary gland that are all sort of making this wall around the third ventricle. And these are all major relay centers for the brain and for our entire nervous system, right? Every single sensory perception that we get goes into the thalamus, right? You talk about the hypothalamic pituitary adrenal axis, regulating major body functions, temperature, appetite, wake, sleep, all these sorts of things. And so keeping in mind, right, that the pineal gland is in back, the hypothalamus and the thalamus are on the sides of this third ventricle, and the pituitary gland is in front, and how they're all orchestrating what's in the fluid, and then how the fluid can orchestrate what it's actually sending to the brain itself from the inside of the ventricle. All right. Now,
I have some questions regarding what you're talking about, decreasing suffering. And I've been following the use of psychedelics in my field for PTSD sufferers and people maybe you've been experiencing chronic depression. And this relates to something you said earlier, is I'm often interested in what is the mechanism, like what's the mechanism of change. And when I meet with somebody who seems to talk about the experience as being transcendent, one of the things that they're sharing with me is this awareness of this unity consciousness, the interconnectedness of all things. And now there's a different meaning that's assigned to their suffering or their struggle, which seems to have the effect of decreasing suffering. So, like, there is a purpose. Your soul has this purpose. And even going through the challenges of your life, there's something much greater. And it seems to be this awakening that occurs. And I want to get your thoughts on what does DMT do, or if somebody's taking psilocybin, what is happening that's allowing them to be able to reach those conclusions?
Yeah, I mean, there's a whole mechanistic, let's say neuroscientific explanation to a lot of those, and I'm not sure we fully understand the whole spectrum, but from my understanding of looking at the studies, essentially it's primarily decreasing the activation in the default mode network. Yeah. That seems to be a primarily, the default mode network is sort of beautifully named, I guess. Is sort of like the default mode. It's sort of like in your default mode, what are you thinking about? And it's sort of this self-referential network that is taking not only outside experiences, but also internal thoughts and we are creating a self-referential image of ourself in this network, right? And so depending on your past experiences, or depending on, how you have or have not been traumatized or anything like that, there are certain activities in the default mode network and certain self-referential thought patterns that are creating an identity of who you are. When those are decreased, the blueprint emerges. And so it's, again, connecting back to this blueprint, right? It's connecting back to your true nature, that there are whatever pathways, right? And this is why, yes, DMT and psychedelics can help in terms of it's sort of like we need a major reboot, right? So we go in, it's sort of like the person's having cardiac arrest and the heart's not beating. Good. Okay. What do? We shock the system, right? So you use electrical current on the outside and it restarts the whole system, right? Neutralizes it, and then it can rebeat, right? Even if it was in a bad rhythm before, I can shock it and try to get it into a good rhythm. Now, right? Especially if you're looking at, single, let's say a therapeutic dose of DMT or therapeutic dose of psilocybin, right? Is, to me, what it is it's sort of like a reboot to the entire system. And in that reboot, you're allowing all that external energy to just quiet down a bit. And what emerges for the majority of people, not everyone, right? But what emerges, there's such a strong sort of default mode network in some people, or it just doesn't allow them to get, or, whatever it is. But what emerges for most people is that blueprint, that connection, right? The understanding of who I truly am. And from that, then the heart is beating regularly again, right? And can we go from that, right? Can we go from that to maintaining that, right? And what is that going to include? Well, you're hopefully not going to expose yourself to more traumatic experiences, although it might happen, and then we might need more, let's say, therapeutic doses. But I've coined a term, it's called RIP-RAP, right? Repetitive intentional practice, repetitive attentional practice. RIP-RAP, right? Repetitive intention practice and repetitive attentional practice. Asking yourself, even after you go through that experience, or even if you're in a state of meditation or you're getting a session of craniosacral or whatever it is, right? What is your riprap? What is your repetitive intentional practice and repetitive attentional practice? Where are you placing your attention intentionally that is helping you orient towards that blueprint, towards that sense of true self, towards that divinity? Because if the patterning, if your repetitive attentional practice is one of repeated trauma thoughts, that then is going to drive into that area, right? You're going to orient then towards trauma. Okay. The intentional practice then is, okay, here's my intention, right? Whatever your intention is. And where is my attention? Even as I come out of that, right? Even as I'm in it, right? Where am I paying attention to? What am I paying? And when I come out of that, now my default mode network has quieted. I can, with my own conscious ability, create a new network of connections in my brain. Those new networks are going to be, it might take time, right? Because I'm trying to relearn. Not only am I I'm relearning something, right? So there might be a memory that keeps on popping up and I recognize that memory. And so I say, okay, let me find another place to direct my attention to. Let me find another place, a place that's safer with intention, right? And constantly reorienting yourself to that, because if you don't, then it's pointless. You're going to get this sort of like, okay, yeah, I had this experience, but then you're right back at it. Right. So every day, every moment of every day is asking yourself, where is my attention going? And what is my intention? And having a practice that you could actually, that you can rip wrap, that you have an intention of love or whatever it might be, gratitude, right? But that you're choosing it. I have an intention of gratitude. Gratitude is usually a strong intention that people can go to. Joy, love, happiness might come later, but gratitude is sort of like, let's find something that I can be grateful for right now. And it might be this piece of paper or this water or this, whatever it might be.
I love all this, but it's bringing some more questions here about the nature of reality. So let's imagine there is this unity consciousness and there's this greater field. So when we are intentionally putting out energy in terms of thoughts or where our focus is into this field, are we receiving back like the ripples of that into our own field of reality? Are we active influencers in our experience?
Absolutely.
I love it.
That's where I started with, right? Is all of a sudden there was a relationship. There was a relationship with this energy. I didn't know any of this, right? It was just sort of like, it was like, hey, hey, is that the third ventricle? Boom. It was like, yes, I am. And I'm like, whoa. I mean, I'm just saying this right now and I'm literally getting goosebumps going down my entire body. Right? Because it's that beautiful. It's that's a response. Right? And how simple is it? I just said it. Right? Yes, I am. Right? Even the I am. Right? Where does that come from? Be still and know I am. Right? A lot of books talking about the I am. The I am spontaneously arose. Right? The I am is that like first, you're talking about like this conscious sort of output, right? The way that I see the I am is there's prior to the I am, and then the I am is, it's almost as if you have this, it's the first impression of any external output from the field. So if you were to picture water coalescing on the bottom of a leaf, and all of a sudden you get enough water and then you start seeing the drip coming. First, it's just a plane of water, and then all of a sudden the drip. When you start seeing the like outward indentation, right? That's some expression that's coming, and it absolutely, it's a relationship. It's a two-way highway. It's not one way. It's a download and an upload, and it's constantly happening. Right. And is it happening at the electron level? Is it happening at the, that's what I'm still in the process of sort of investigating, but it's absolutely relational. And this is the part where even in, with my patients and stuff like that, it's like we try to get into is we as human beings, and some people are fortunate enough to be born with this, and, they have an increased capacity to hear. They have an increased capacity to notice the most subtle of sensations, and that introspective ability and having interoception, right? That felt sense. Some people are like, I don't feel anything. Well, what's that? Right? When we were in bodywork school, right, we would take a book and put a hair under one page and you'd feel it, 2 pages and you'd still feel it, 3 pages and then you wouldn't feel it anymore. And then, but some people could feel it, and then you'd get down and some people could still feel 20 pages, and then as time went on, you could increase the sense of feeling. And so even that, right, it's that if I say something, even a thought is an energetic outward. I can choose, right? Is there an intention behind this? And what is that intention? Then, do I want to pay attention to that? Do I actually want to engage in the energy of that? And now I say, yes, this is something that I'd like to manifest. And then there's a response, right? And it's not linear. It's not linear in your time, but there will be a response, right? Now, most of us don't hear it. We don't feel it. Does that mean it's not there? No. I would actually say that, and this is why, I started writing kids' books, for instance, because the amount of time that we spend teaching kids how to write the letter A or the number 1, right? No, A, right? If we actually started teaching kids about this quality of, let's say, listening to yourself, listening to the universe, having increased introspection, what would our word look like? And so, absolutely. And that, that to me is the brilliance, but the relationship starts from, right, when you send out that initial impulse, it starts from that pure field. Right. So that to me was the practice, is essentially dropping everything, right? Dropping everything, and remembering whatever word you want to use, right? Remembering that true nature and resting in that, whatever you want to call it, divinity, God, prior to I am, awareness, consciousness, a lot of words that can be used. Now, when you feel like you have that space, you're in that space, right? Then it's the first thing for me is actually, what's your intention? Is you create an intention. Then from your intention, right? So my intention, let's say my intention, right now, my intention is like, and my wife and I, we've used this is, what are we, when we say our vows, when we got married, what was the question that we had? Are we going towards love? That was it. In your choices, are you going towards love or not? And we vowed to continuously go towards love. That then is the intention from this space of pure awareness. The intention for me is love. Now, right, then let's say a thought emerges, right? So it's sort of like, here's this white canvas. Love is my primary intention. So that's sort of like the outpouching of the I am. And then a thought, right? And it's just sort of like, right? Does that go towards love? And look, if we are talking about if we are talking about reality, then it's not, oh my God, I can't believe I had that. You're going to have every thought available to this, to every single, you can't even imagine the possibilities of thoughts that emerge because everything is possible, right? So a thought comes up, right? And it might be the worst possible thought that you had. And what do you do with it? Oh my God, I was coming from love and I had this horrible thought and that's who I am. And right. And now all of a sudden I'm shriveling back down into a little tiny self. And that one thought has generated another thought. And there's my default mode network that's going, right? As opposed to, oh, wow. And what do? You rest back in awareness. Right? Or back in that pure level of the total potentiality, total potential space where everything is potential. There's no filter, right? What happens is that it's like we think we're there and then all of a sudden all these filters come on. You're like, whoa, you're putting a filter. There's already, filters that are coming up. And right, all this, from my perspective, all this is it's a practice, and it can be quite profound, and it absolutely is relational. And the first time that this sort of opened up for me was paying attention to the cerebrospinal fluid in my third ventricle and meditating on that. And then connecting that to the I am.
So this is something that if we bring our awareness to it, our attention and focus, that we can generate that energy in that space.
That is my experience.
Okay.
And, you mentioned Kundalini. I don't know how much time you have or anything.
No, I was going to follow up with that because I didn't get that answer.
Yeah. So, right. So the first thing, if you're interested in any of these practices that are sort of like body centric, that are embodied, right. And even for me, thoughts, emotions, or feelings or anything like that. Right. When you notice something, first thing, right. So if you can, right. So the way that I sort of take people through it is, first, before trying any practice, first find a resource. All right. What a resource is to me is a place that you can direct your attention to that feels safer. A lot of people, when they start doing any of these practices, they don't have a resource. And so things start happening and they don't really have a place to go to. They don't have an orienting sort of principle. It's not a rudder. So find a resource first. And that might take you 2 days. It might take you 20 years. But find a resource, right? It could be, I've crystals here, right? Sometimes I hold the crystal, right? Because the resource for me might be having a hard time with bringing a resource into my body. So it's external. Maybe it's a plant. Maybe it's going out to the ocean, right? And you slowly are doing that rip rap practice with a resource. And that might be putting your feet in the sand or putting your feet in the ocean or holding, essences or holding a picture of your grandmother or something like that, right? Whatever it might be, but a place that you feel that you can actually, that whatever your default state is, that when you pay attention to this one thing, you actually feel safer. Right? So that's number one. If the resource is out of your body, slowly try to bring the resource into your body by doing like a titration practice, like a slight, I call it a titration practice. Essentially, you're shifting where your attention is from the external resource to a resource that you have internally. All right. I was in the lab, right? I've been in the lab a number of times. If we all of a sudden, if we say, oh, you need a resource, it's got to be internally. Well, what happens? Some people literally explode. They can't, right? They don't have the capacity to actually hold a resource in their body because of all the trauma that has happened to them in their work, right? But just like in lab, if I took a 1 pH solution and a 15 pH solution, and I combined, and I had a gallon of each, and I put a gallon of the 1 pH solution into the 15 pH solution, do you know what would happen? Explosion. Right? Because it's too much energy at the same time reacting, and I get an explosion. Right? Now, how do I titrate in the chemistry lab? I have my 15 pH solution. What do? I have a little pipette and I open it up. Right? And what do I get? A drop. And then I close it. What reaction do I get? 0. Almost, I can't even tell. Right? Even if I had a pH meter in that solution, it wouldn't even register a change. But what do I do over time? Drop. And it might take me, our chemistry labs were 3 hours long. It took us 3 hours to do this. But making that analogy of that titration with our own body, right? How long does it take for me to titrate a resource into my own body? It could take, you could already have it, or you could actually, it could be 2 years, 20 years, whatever it might be. But where you shift your attention from a place that you feel safe to maybe it's your pinky, right? It's the outermost part of your pinky, and you say, okay, I can bring my attention here and I can feel okay. As soon as I don't feel okay because I'm paying attention to my body, I go out to my resource that I'm holding, my crystal or whatever it is. And then I slowly come back to my pinky. And so that's a titration. And that's actually a practice that people can do to start to increase the ability of their resourcing. Right. Then you bring it, you have a resource that's in the body. And that's where we start from, right? Is a place that we can actually in the body, whether it's your breath or whatever it might be that we feel, that we feel safer. Right. Then when we do other practices, whatever it is, whether it's a breathing practices or a meditation practice, right? You asked about Kundalini. Anytime that you're trying to even, experiment with anything or be curious about anything, right? There's a curiosity. There's a curiosity that's playful. See if you can be curious about it playfully, as if you're a 2-year-old child, like watching a butterfly fly for the first time. And you're totally curious about it. And it's sort of like, oh, wow, that's cool. Right. Then all you got to do, just like what you said, right? Bringing your attention to it and say, I see you. I see you. Now, all of a sudden, what you're doing is you're saying whatever that is, right? Whatever, even if the unknown, I see you. And you just leave it at that. I'm not trying to change you. Not trying to alter you in any way. I just see you. And so with people that are interested in Kundalini in this energy. Right? This is kind of like one of those beginning, practices, let's say, that, I mean, we're still learning about the theory of Kundalini, but essentially, theoretically, it's sort of a dormant energy that's dormant at the bottom of our spine in the sacrum, close to the sacrum. And that certain practices, Kundalini practices, various yogic practices can awaken it. And it's depicted as a serpent. And it's interesting, it's a serpent, but a serpent, some sort of energy that arises up the spine and can activate, comes through the brow center, up the crown chakra, and it sort of opens us up to, awakenings and like you were talking about, some people sort of supernatural abilities and things like that. For many people, Kundalini awakenings can cause sort of psychiatric disturbances, and they go to the emergency room. And I have an ER doc who's very aware of these things, and for the last 15 years, he's now asking people, were you doing anything spiritually or anything like that? And instead of putting Haldol in them, which is an antipsychotic, and admitting him to the psych ward, he essentially puts them in a quiet room, creates an environment of safety, and helps them come down, and essentially helps guide them back to safety, right? Again, back to that resource.
Doc, this has been a big part of my message and my platform recently, because I've seen an increased amount of people who are going through spiritual awakenings, who are labeled in the psychiatric industry as bipolar or psychotic, something of that nature, when they just were having a spiritual awakening. And I'm attributing to this, and I want to know if you've heard about this, as to this rise in energy on the planet, this movement, this transition to unity consciousness or a 5-dimensional reality. And then we're seeing this increase in these experiences where people don't necessarily have the container for it, the consciousness for it, and the medical system is mislabeling it.
Absolutely.
Okay.
Spot on. And I love how you use the word container, right? So that's why I'm trying to write kids' books, because you don't know when it might occur. It could occur spontaneously, right? All of a sudden I'm walking down the street and all of a sudden it occurs and I'm not ready, right? If you're going into it, then using your analogy of container, assessing what is my container? If something like this happens, if we are, if collectively we're evolving consciously and this might actually occur to me, could I actually help kids increase the quote unquote size of their container to be able to hold it, but do it prior, right? So that we're increasing the container we're increasing that, what I like to call the window of tolerance, or, so that anything that arises, we can actually hold. If you don't have the container for it, then yes, right? It's going to happen. And I get a lot of those questions too. I'm not a psychiatrist, right? But I get a lot of those questions. And essentially, right, what I do is I say, look, let's rule out X, Y, and Z. So let's rule out seizures. Let's rule out tumors in your brain or anything like that, right? And let's rule out anything else. And then, right, and I will sit with people for hours and sort of go through their stories and sort of give them recommendations. I don't practice medicine across state lines, but you're absolutely right? So what can we do to actually increase the vessel, the chamber that they are using, their window of tolerance, that they can then, right? And that doesn't matter. Even if I'm sitting here and doing some meditation practice, I go to the Wim Hof convention or, the holotropic breath convention or whatever it is, and I'm doing something and I don't have that container, something's going to happen. And I think that educating, again, that's what I like to do, is go to ER doctors and educate them on, hey, not everything that you see is actually a psychotic experience. It's not a psychotic break. It's not schizophrenia. It's not bipolar, right? Ask them these questions. And my friend, that's exactly what he's doing, is he's actually designing protocols for ERs to ask people questions, right? And I would also, if you have the mental capacity to do so, I know that when you're in that state, it's really difficult, and I totally get that. Even telling an ER doc that you were doing a certain practice, right? Like I was, right before this happened, I was doing a lot of breath work, and I was doing a lot of this, and I was doing a lot of fasting, or whatever it might be, or I was on a water cleanse for 7 days, and I was doing this, right? People are sort of doing these things. Tell them, right? And that might lead hopefully that might lead them, but I love the fact that you're doing this, and slowly it's also getting into the ER docs, so that we're not, we don't have to just inject people with Haldol. But you could imagine that when this energy rises or awakens, that sometimes it has that container, sometimes it doesn't, right? And oftentimes, in my experience, when you have worked with, for instance, developing a resource, and when you have worked with having a resilient nervous system, when you have worked with being curious about things that are appearing in your mind, even outside of it, the more then you're able to contain that energy rising. And just like what you said, it's not like an explosion, but now all of a sudden it actually becomes a relationship, right? Where just like I'm opening up a fountain, could you imagine having the recognition, right? Where you start noticing, it's like I'm opening up, I shake a bottle of carbonated water, right? And now I just open it a bit. Could I open it all the way? And absolutely, right? But do I want to, right? Your kids might do that, right? You're like, oh my God, okay, you got all over the place, right? But this is an analogy for my own body. I don't want that to happen, right? Can I open it, right? I know I'm actually feeling the energy build, right? I'm feeling something build. Do I want to open up the cap instantaneously, spontaneously, just have it explode? Probably not. Right. So that's why also the introspective abilities of saying, okay, I'm noticing something, right? What is that? Let me breathe. Let me balance my nervous system. I could freak out, right? And some people have, oh my God, I don't know what it is. And now all of a sudden I'm anxious, I'm fearful, and that goes down one path, right? Or I could really work on balancing my nervous system, because I've done that, because I've worked on that. Now I'm saying, I'm doing the physiological sigh, double breaths. Maybe I'm doing a 4-4 breath. Maybe I'm doing a 5-4 breath, whatever it might be, right? Maybe I'm humming, right? Any tools that that sort of like, okay, feeling this energy. Right, this is what I'm noticing, right? This is what I'm noticing. And I'm noticing, right? And you actually have the control of the valve. That mentally, intentionally, attentionally, you actually have the control of the valve. And you can let the valve go as much as you want, to the degree that you actually want to. That comes from preparation. And that's what I think our role is for our children, is to teach them, to give them the tools that they are prepared to come into this world. And even with this evolutionary consciousness that's occurring, to give them the tools that they feel resilient enough, that their container is wide open, that they can hold this capacity, right? Wouldn't that be beautiful?
It's necessary.
It's necessary, right? So that's where, I have 3 kids, and that's where, that's what we try to do is, it's a challenge, but that's where, effort, I think, needs to go towards. And also in ourselves, right? And if we are interested in experimenting, whether it's with meditation or breath work or, psychedelics or anything like that, right? Is just, simply ask yourself, okay, what's my resource? If something happens that I feel totally, unsafe about, or totally, uncomfortable with, where do I go to? Where do I go? And have that resource before you do it, and then start the practices with the cerebrospinal fluid. Then, right? So my theory is that the cerebrospinal fluid is the conduit for this energy to rise. It's perfect. It's anatomically absolutely perfect. It's mechanistically absolutely perfect. And right, it's fluid. It's 99% water. And if your audience is in, the more, keep out, watch the research that's going to come out on water in the next 20 years. It's going to be incredible. It's going to be amazing. We're going to learn so many different things about water. And the ability for this energy to be housed and transmitted in this fluid, through this fluid, to our fascia, to the rest of the plasma in our body, is incredible. And learning then, right, how to regulate the nervous system, how to balance the nervous system, how to bring resiliency to the nervous system so that we can open up those channels, we can open up that conduit, we can open up those things as we want, as we are wanting them, that we can actually do that consciously, with intention, in a controlled fashion, within our vessel, within our container.
One final question, because I could probably talk to you for hours, but it leads to this energy, love. Is it a healing energy? Can we use it to heal ourselves and to heal others?
That's a good question. I think the answer, the question is sort of, it's getting at the energy isn't healing, but it can heal. It's not like it goes out trying to heal, but in its nature, it is healing. I'm not sure that when we relate with it, it naturally heals. But it's not, oh, I'm going out to heal. If that makes sense.
It does.
It's sort of like, if I put my hand in water, will my hand get wet? Or does the water want to get my hand wet? And you go, well, the water's going to wet your hand. The water doesn't have an intention of wetting your hand, but it will wet your hand if you put your hand in the water.
Yeah. I mean, I think about dis-ease as our bodies at dis-ease. And so when we're talking about being in this state of energy, it's this It's this connection to source. It is where our body then naturally is in alignment, and then it heals if it's in disease.
Exactly.
Yeah. Well, fascinating conversation. Like I said, I could speak for hours on a lot of the specifics of these topics, but for today's introductory conversation, I think it was necessary and builds off a lot of other conversations I've had. I want to give you the opportunity, if there's anywhere that you're promoting your work, or if people can get in touch with you. You might not want that, but if there's anywhere where you're promoting work, please let my audience know about you.
The best way to get in touch with me is through Instagram at Dr. Zappaterra, DrZappatera. I do get a lot of responses, and so if I don't respond, apologize. I do have a few people who sort of screen them. I get a lot of responses, so I really go with. I've really asked my screeners to sort of go with the people who seem authentic. There's a lot that it just I don't have enough time. My priorities are sort of my family and my kids and stuff like that. And I could spend 24 hours a day, 7 days a week responding to people. And I usually do like pro bono talk, to people if they need it, mostly guidance. I don't practice medicine across state lines. But if you do have a question, just like what you brought up of, hey, my doctor is thinking of putting me on psych medications or something like that, and you want like a second opinion, not that it's not official. I don't charge you or anything like that. And then I got kids' books on Amazon, just trying to sort of open up this conversation of, one is called I Am, the other one's called All Love, All One. A is for awareness. It's instead of A is for Apple, as a dictionary book, A is for awareness. And then Close Your Eyes, what do you see? And we're coming out with another one on the interconnection of all beings, including, stardust. So, if you're interested, and then always, if you get a book and like it, going on to Amazon and giving a rating always helps. But I really do this out of the love of just trying to get this word out there and trying to get people to find a safer space to direct their attention to and to connect with their true nature.
I love it. Dr. Mauro Zappaterra, I want to thank you for a radically genuine conversation.
Thank you very much for inviting me.